All right, let's talk about something that's way more common than you might think, but something people just, well, they don't want to talk about it. Fecal incontinence. Today, we're going to change that. This is your guide to understanding what's going on and, most importantly, how to get back to living a better quality of life. Let's just get this out in the open right away. Even the medical textbooks call this a distressing and embarrassing condition. And honestly, that's putting it mildly, right? It can totally disrupt your life, your confidence, everything. If that sounds familiar, I want you to hear this loud and clear. You are so not alone in this. And when I say you're not alone, I really mean it. Check out this number. Some studies show that this affects up to 1 in 5 people. That's huge. So let's get one thing straight right now. This is a medical condition. It's not a personal failing, not by a long shot. Okay, so what is fecal incontinence really? Well, to figure out what's going wrong, it actually helps to first understand what's supposed to be going right. So let's talk about what it actually means to have continence. It's not just one thing. It's really like a team effort inside your body. You've got 4 main players: the consistency of your stool, the strength of your sphincter muscles, how well your rectum can stretch and hold on, and of course, the nerve signals that act like the coach, telling everyone what to do. When that whole team is in sync, everything works just fine. So, if continence is a team effort, incontinence happens when one of the players gets injured or maybe the coach's signals get scrambled. So why does this happen? Let's dig into some of the most common reasons. A lot of times, it's not just one thing. A really common cause is an injury to those sphincter muscles. This can happen during child's birth or from certain surgeries. Then there are nerve issues. Things like diabetes or spinal cord injury can mess with those crucial messages between your brain and your bowel. Sometimes it's actually about the stool itself. Chronic diarrhea can just be too much for the system to handle. And on the flip side, really bad constipation can cause leakage around the blockage. And finally, things like radiation therapy can change the rectum, making it less able to do its job. Okay, with so many possible causes, you might be thinking, how on earth do we figure this out? The good news is there's a clear path to getting answers. Let's walk through how a diagnosis actually happens. It all starts with something really simple. Just talking. Seriously, the most important step is having a thorough conversation with your doctor about what you've been experiencing. From there, there's usually a gentle physical exam to check muscle tone and things like that. And only if they need a closer look, you might move on to some more specialized tests. And don't let the phrase specialized tests worry you. For example, one common test is an anal ultrasound. It's just a way to get a really detailed picture of those sphincter muscles, kind of like an inside look to see if there's an injury or a tear. This helps your doctor pinpoint the exact problem so they can find the best solution for you. All right, so once your doctor has a good idea of what's causing the issue, you can start talking about treatment. And here's some really great news. The approach almost always starts with simple, non-invasive things that can make a world of difference. A lot of these first-line treatments are about managing your bowel habits. We're talking about things like small dietary changes, maybe cutting back on caffeine or artificial sweeteners that can be triggers. Sometimes just adding a fiber supplement to bulk things up is a huge help. For others, anti-diarrheal medicines can be a game changer, or even setting up a structured bowel program to make things more predictable. Then there's something called biofeedback, which is basically physical therapy for your pelvic floor. Think of it like going to the gym, but for the specific muscles that control continence. It helps you retrain your body, improve sensation, and get that brain-to-muscle coordination back on track. It can be incredibly effective. And for some immediate, day-to-day help and peace of mind, there are also some really practical tools out there. These are removable devices, like little anal inserts or a vaginal bowel control system. They simply act as a physical barrier to prevent leaks, which can give you a huge boost in confidence while you're working on other treatments. So, what happens if those first-line options just don't cut it? Well, that's okay. It just means it's time to look at the next level of support. And trust me, there are some amazing advanced treatments out there for people who need them. One of the go-to therapies here is something called sacral neuromodulation, or SNM. The easiest way to think about it is like a pacemaker, but for your bowel. It's a tiny implanted device that sends gentle electrical pulses to the nerves that control everything down there. It's all about restoring that communication highway between your brain and your bowel, and it can be a total game changer. And when I say game changer, look at this. In the big US trial for this device, A whopping 83% of patients saw their incontinence episodes cut in half or even more after a year. And for almost half of them, 41%, it meant they were completely continent again. I mean, wow, that's not just an improvement, that's getting your life back. Another option that's also minimally invasive is using something called a bulking agent. Basically, a doctor injects a safe gel-like material into the wall of the anal canal. The whole idea is just to plump up the tissue a bit, helping it to close more tightly. It's a pretty straightforward procedure that can be really effective for people with milder symptoms. Now, remember how we talked about muscle injuries, especially from childbirth? Well, if there's a specific repairable tear in that sphincter muscle, a surgeon can actually go in and fix it. It's called a sphincteroplasty. They essentially bring the torn ends of the muscle back together to restore that muscular ring. The short-term results for this can be excellent. Okay, let's talk about something really important: ostomy surgery. For way too long, people have thought of this as a scary last resort, but we need to change that thinking. For people who have tried everything else and are still struggling, a colostomy isn't an end, it's a new beginning. It can be an incredibly liberating choice that gives you back complete control and ends all the anxiety. It's all about quality of life. Whew. Okay, we have covered a ton of information here, from how the body works to all these different treatment options. So what's the bottom line? What are the big things you should take away from all this? First, and I can't say this enough, this is a common medical condition, not something you did wrong. Second, there are almost always specific physical reasons for it. Third, there are so many treatment options, from simple diet tweaks to really advanced therapies. And finally, the most important takeaway of all, the whole journey starts with one single thing: talking to your doctor. That's it. That's the first step. So, knowing that there are so many effective ways to tackle this, the real question is, what could your path to improvement look like? Help is out there. Hope is real. This is not something you just have to put up with. It's about taking that first step to get your control and your life back.